into your daily routine. Happy Topical is a customizable product, which means that we at Happy will customize the product for you based upon your past medical history, hair loss history, and your allergies and sensitivities. And if you have any of those sensitivities going on, we will basically change the formula just for you and ship you out a new bottle. So for that being said, so let's start with say how to apply the topical product. So for many of you guys are going to be using a topical happy customized happy Ed formula, and the key is to really to minimize the side effects. So first of all, when you want to start out, you want to start basically with a clean scalp. It doesn't mean basically it has to be after shower, but you just don't want to have like a lot of gunk basically in your hair or products in your hair when you get started. Number two, when you get the products, and I'm going to show it to you. So here's one of our bottles. The bottle is going to come. There's a basic calibrated pipette, and basically you're going to take the pipette out, and then you're going to go to 0.5 ml, and you're going to apply it to one side of the scalp, and then you're going to another 0.5, and you're going to apply it to other scalp, and with your hand you're going to basically rub it in. So it's basically two pumps, because two pumps achieve 1 ml. And the question people often ask, is it once a day or twice a day? So it's technically twice a day, but you want to start off doing things once a day. So you could do it once a day for a week, so your body basically get used to it, and then you want to do it twice a day. Special note for females, please realize that the woman formula, the minoxidil concentration is 6%, whereas the guy formula is 8%. And people always say, well, how come my wife is using a different concentration? The reason is because in females, we figured out that the 6% is still good prescription strength, but it doesn't give you like a lot of peach fuzz. But it's also really important to get a minoxidil directly onto your scalp and not onto your face. So our recommendation is that if you are using the product along the frontal hairline, don't just put the pipette right in the front. Go about 2 to 3 inches behind the hairline, and basically then empty the pipette onto the scalp and rub it in. By being cut a little bit behind the hairline, you prevent it from getting onto your face. Now let's talk about the liposomal formula. So the liposomal formula does not come basically like this, basically with a pipette. It's a pump, and the pump is already pre-calibrated. So you just do one pump, basically apply it to the left, another pump applied to the right. So it's 2 pumps twice a day, but there's no calibration basically on a dropper. People always ask, what is the point of the liposomal? We have liposomal because studies have been shown to reduce the penetration of finasteride into your body, and as a result, it reduces the risk of any form of sexual side effects. So if you do want the liposomal, it is on our website. The scalp dermal roller. So dermal roller is a roller that has about 540 spikes at the tip. We've gone through this many times in our previous AMA sessions. The whole idea of dermal roller is a couple things. One, basically activate by rolling, you actually increase blood flow to the scalp, and number two, it creates tiny holes into the scalp. So as a result, when you apply the topical, it could penetrate deeper. There's really no right or wrong when to apply a dermal roller, before or after the Happy product. We believe that when your hair is wet, you would dermal roll easier. So now we recommend applying the product first, the customizable Happy solution, and then gently dermal rolling. Couple tips with dermal rolling: do not be very aggressive. We recommend the 0.25 dermal roller, and we have an amazing dermal roller on our website that you could buy. We recommend you could do it 2 to 4 times a week. Some people decide to do it every night, but ideally, if you had a couple times a week, that would be great. Again, idea is to apply topical first, gently roll, don't put on too much pressure, don't make yourself bleed, and don't stay always in one place. I know on the web, there are like a lot of people, like a lot of forums that recommend, using a deeper depth of a dermal roller, like a 1.5 or 1.25. Those really do hurt, and we do not recommend them. So if you do a lower depth, like the one that we sell on Happy Ed, you could practically use them almost every night, definitely more frequently than like once or twice a week. Also remember to clean your dermal roller. So my recommendation is to get an alcohol spray on Amazon. And what you do, basically, you want to just spray the tip and just put it in it for like a minute, clean it before, after procedure, the dermal rolling, and change it often, like once a month, probably just change it out so you don't get infections. So that was basically the topical Happy Head formula, which is, again, it's customizable. Now we're going to move on to the oral medication. So the key with the oral medication is really intended for people that just makes it easier to take the medication. To a lot of patients that just don't have time to sit there and basically rub it in. Although, I mean, I do it. I mean, it takes literally like 30, 40 seconds, but sometimes just taking the pill is easier. We have many different versions of the oral. We have oral minoxidil, or finasteride, oral dutasteride, and a super capsule. And we'll go through all those later on. Whatever you want to choose, the most important thing is consistency. That's the biggest tip I could give you. You know, Rome wasn't built overnight. It's you take it consistently. That's really what makes the biggest difference. I take a blood pressure I take a cholesterol medication, and like I used to take it like here and there, and it wasn't really helping. But now that I take it every day, I can really see the drop in my cholesterol levels. So really, the key is doing this product consistently every day. Take the pill, and that's what's really going to give you the best results. So the oral minoxidil basically comes in the 2.5 milligram tablets. And what like a lot of people do is you could break it in half, and start out basically with taking a half for like about 2 weeks or 3 weeks, and then before going to a full tablet. So you just want to touch it up so you don't change like your blood pressure a lot. So, and your body kind of gets used to it. So just kind of half, and sometimes when people come to a quarter for 2 weeks, half for 2 weeks, and then a full for 2 weeks. So you kind of touch it up slowly. You can also buy a blood pressure machine at home. You can get on Amazon and you can check your blood pressure to kind of monitor your blood pressure. For people that are taking the super capsule, remember, super capsule combines the minoxidil, finasteride, and vitamin D all in the same capsule. It streamlines the entire process. So you could take one pill a day and you're doing basically, it's as if you're doing 3 tablets. And it's super helpful. A lot of our patients love the super capsule. Is easy. You just take one capsule and you just move on. With respect to supplements, so we have the happiest supplements. I know the supplements are important because it has vitamin D, collagen, keratin, probiotics. And our supplement is very similar to a very popular supplement on the market, but better because we added more collagen, more probiotic, and more biotin to it. It's 4 capsules a day, so you could take 2 capsules in the morning and 2 capsules at night. I know it's a lot, but it really will help you, especially when you take it in conjunction with a super capsule or the topical happy head. And a tip is that since you're doing the prescription medication happy head, doing the supplements, it's great to kind of promote healthy hair and healthy skin. So now we are going to have a giveaway at the end, but the first person to answer this question will get a free scalp dermal roller. And here's the question. So how often do you typically need to apply the customizable happy and topical solution? And first person that answers the chat will win. Now we're going to go to the questions. Okay, guys, a lot of great questions today. Thank you so much. Okay, so what is the best way to use hair dye in conjunction with happy head? This is what I'm using Herbitant permanent hair color gel. So here's my recommendation of hair dyes. As long as you're going darker, I'm okay with it. If they're alcohol free, ammonium free, that's even better. Going darker is okay as long as you're not basically dyeing every day. If you're going lighter, like basically highlights or red or blue color, those basically are more likely to damage your hair. So stay away from the ones that are basically lighting your hair. But darker is okay. So I remember from my training that chronic use of steroids will make your skin thin. Steroid is an ingredient in your hair formula. Can you please justify the use of steroids? That's a very good question. So we do have slight amount of hydrocortisone, which is over-the-counter hydrocortisone in our formula. The reason why we have it is because the minoxidil and the finasteride, the minoxidil and the vehicle base and the retinoic acid could be slightly irritating. So we add some hydrocortisone in it. I do agree that chronic use of steroids basically could thin out the skin. However, a couple of things. First of all, we do have retinoic acid, which also helps counteract that. Number two, if you don't have some hydrocortisone in it, it could be very irritating. Number three, your scalp is very thick, so to really thin out the scalp is basically very unusual. And number four, it's just an over-counter hydrocortisone, so it's a very minimal amount. Thank you for that question. But again, if you don't like the hydrocortisone in the product, it is customizable. So we could always switch out take that out. So let us know. Email us at help@happia.com, and we're going to take the hydrocortisone out. Also, you have to realize that we do have some competitors, and our competitors use way, way, way stronger steroids that we don't. And it's kind of standard in the industry to have some steroid in it. So it's kind of like standard of care. So we're not doing anything beyond the standard of care. Dr. Ben, can you please explain to safely dye my hair while using Happy? Can I apply hair over the Happy and still get good dye results? Well, yes, it should not be a problem. You could definitely use it in conjunction with Happy. Will you ever create a foam application instead of a topical version? Um, we're working on it. We actually had tried it many times before. The foam application, many issues with it. One of them is that you actually have to license the foam product from another company called Fagron, and we have to use their bottle, and it really escalates the price probably by $20. So that's really one of the limiting factors. But we're currently working on it. Thank you so much. We're working on it. How important is scalp massage, and is there a good technique or device that you recommend? Yes, I recommend the Dermal roller. Dermal roller is probably your best scalp massage technique, because when you roll basically back and forth, it creates tiny holes in your scalp, increases blood flow, so it's better than a massage. So I'm a big fan of dermal rolling. Use a 0.25 depth. You could buy it on the Happy Head website, and you could practically do it every night. Hi, Dr. Ben. Would you advise using oral finasteride or oral finasteride for a 52-year-old woman experiencing hair loss due to menopause? If so, which one would you recommend? So typically, that's a great question. Typically, the standard is that usually we start patient on finasteride and see how you do. So I would do finasteride and do it for 6 months and see how you do. That being said, dutasteride is a better molecule. It's an FDA-approved medication that use off-label for hair loss. So basically, honestly, they're both good, but a lot of doctors start with finasteride first. But you could go directly to dutasteride, and you could use it. So, and we also have the dutasteride super capsule, which is dutasteride, minoxidil, along with vitamin D, and that might probably be a better choice for you. Uh, the new liposomal formula is better than existing liquid. It's different because the efficacy should pretty much be the same. The only reason why we have liposomal is because when we put the finasteride liposomal, the liposomal formula in studies have been shown to prevent a lot of absorption of the ingredients into your body. As a result, basically decreasing your side effects more. So if you're already using a topical and you're not having any side effects, just keep using the topical. If you've had oral finasteride before or topical finasteride and you had sexual side effects from it before, then you're better off using the liposomal formula. And the reason why I said that if you're good with the current one, don't switch, because liposomal is just a much more expensive product to make. Is there a possibility of hair growth in the area where there are inactive pores on the scalp, in the thinning area when using the minoxidil drops? So let's talk about it. So there's thinning and there's balding. We should actually have photos of it next time.
Okay.
So thinning means you look at my scalp, and my hair is there, but you can just kind of see the scalp. So that's thinning. So all products work for thinning hair, or at least they should, work for thinning hair. But if you look at a scalp and you're bald, like there's no hair there, no products, oral, topical, Happy Head, any competition, it's just not gonna work. And if there's any further questions, you could definitely ask one of the doctors, and they'll let you know if you're a candidate or not. Can we have a customized formula in a new liposomal? I don't think the liposomal is customizable. It is not. Unfortunately, it is not. It's a very expensive product to make, because right now with the current Happy Head formula, there are 50 different versions of it. With the liquid, we just cannot do that with the liposomal. It's just too expensive. Um, I have an androgenic alopecia. Should I use the topical solution, anti or minoxidil? If so, what dosage? Well, this is what I recommend. I always doing both together. The bundle actually, patient do get better results. If you do want to do both together, my recommendation is try the topical first for about 3 to 4 weeks and then add the oral minoxidil to it. The reason is because by doing topical, your body gets used to it, so it kind of reduces some of the side effects when you go on the oral. You just don't want to do everything all together at the same time. Another recommendation is basically to alternate every other day. So, for example, one day you could use topical, next week you do oral. That's another way of doing it. Again, this way you're not adding too much all in one day. So, they're both good ways of doing it. Sure. Do we have closed captioning on? Next time. Okay. Yes, I will talk slowly and we will definitely have closed caption on next time. Thank you for your recommendation. Is creating a bad effect? I use only 5 grams and only 2 or 3 times a week at the gym. Didn't see any issues. So creatine is typically bad for you, and we typically discourage patients from doing it. The reason is because creatine will increase your testosterone level, which means it increases your DHT level, which means it's going to cause more miniaturization. So we usually tell patients that creatine is bad and get off of it. How what do you call the Dermal cleaner on Amazon? Just get an alcohol spray bottle. Just Google, just or Amazon, just alcohol spray. Usually like 70% alcohol spray in a bottle. I just buy it. I just spray it down. If I stop using topical, will the hair growth supplements maintain any results? Typically not. I mean, the supplements are good to give you like a healthy hair, but they're unlikely to keep the results that was grown from the topical. The key is to continue to use the topical. Now, there are some patients after 6 or 8 months to go down to once a day as opposed to twice a day, and that may help maintain it, but some people may have to do it twice a day. Remember, everyone's different. And somebody said twice a day application. Yes, the answer is twice a day application. That's the key. That's very important. So I don't have androgen alopecia. I had a bad run with S-curl hair texturizers, and it caused issue in my hair. I tried to get PRP treatment to help, but it actually caused a shock loss on my hair. It's been an uphill battle. How do I get my hair back? So Happy It should help. I mean, sorry you had that experience, but Happy It should help. And sometimes the oral Happy It basically will help as well. So you could use the topical, but you have to realize with the topical minoxidil, some people could also get an initial hair shock, and that's normal. With the oral minoxidil, some people could get initial hair shock as well. With the oral finasteride, there's typically no hair shock that's associated with it. But yeah, so if you're having hair issues, I would probably do the topical Happy It or the oral Happy It products. Should I start with the advanced formula or is the dutasteride better? I would probably start with the dutasteride alone and see how you do. I have not seen any difference and I've been using it faithfully. What can I do? Do I have a shampoo conditioner? So first of all, I want to know how long you've been using it. Number two, if let's say you've been using it for 6 months and you're not seeing really much results, probably adding an oral might be beneficial. We also have the Happiest shampoo and conditioner, which basically, it's enriched with biotin, collagens, keratins, probiotics, and that could also help as well. But first, remember, you need to really use it for about 4 to 6 months to see results. So what is latanoprost and why should I choose it rather than finasteride? That's a good question. So latanoprost is another form. It's a formula that is used. It's FDA approved for like high pressure in the eye, but it's used off-label for hair growth on the scalp. It does help. If there is any choice between just using the latanoprost or the finasteride, I would actually choose finasteride. I think that would be better. We do have some that are combined together, so the combination is good. But if there is a choice between the two, I would choose finasteride. Who are the dermatologists that work for Happy? That's a great question. So the dermatologist we have is Dr. Corey Williams, Dr. Mark Sirota. There are also several. I think there's also Dr. Green. I'm Dr. Ben Benham. I'm the founder and the chief medical officer. So I don't see patients on a regular basis, but I kind of oversee like a lot of the overall operations of Happy Head. But yeah, those are the top three. So Dr. Green, Dr. Williams, Dr. Sirota. Um, Thank you for that question. We should probably list all of the doctors on our website. Um, so, what is whey protein concentrate versus whey protein isolate? So, whey protein. So there are different versions of the whey protein, and the way you get to whey protein isolate is that you take certain amino acids, and during the manufacturing process, you isolate them and increase the concentration within the whey protein. And a lot of those amino acids include like leucine, isoleucine, valine. Now, what's the significance of this? The significance is that those amino acids in high concentration will actually increase and promote more testosterone production, which will lead to more DHT production, which will lead to more miniaturization. So we don't usually recommend the whey protein isolate. We recommend whey protein concentrate or vegan protein. So if you're doing the isolate along with creatine, that's bad. Please stop. Can a topical change my hair color? Typically not, but I've seen it sometimes, but it's unusual. What is the most common age where excessive shedding occurs, where it might be hair loss? Well, I mean, everyone's different. I think it's really hard to answer. I mean, some people shed a lot. I mean, there's some patients that shed in the early 20s and they're bald by age 25, and there's some patients basically that go through a midlife crisis in their mid 30s and start to shed a lot. So that's a tough question. It depends. It varies upon amongst individuals. So that's very hard to answer. How do I know if a shedding is too much? So the shedding usually, so usually the way we say is that if you're losing about 100 hairs a day, that's basically you're shedding too much. It's acceptable and normal to shed about 100 hairs a day. So, but yeah, so anything over 100 is too much. I've been using the Happy Head formula for 6 months. Is Sunday everyday shedding normal? Oh, absolutely. There are many reasons why people shed. First of all, your hair is going to go through various cycles, so you're going to shed at various times during the year. Number two, people tend to shed more during fall and winter, and that's normal. So yeah, so that's all normal, and also doesn't necessarily mean that if you're shedding that you're losing a lot of hair. You could grow a lot of hair and you could still shed a lot too, to a point where you could be still net positive. So the shedding and hair growth are completely different things. What PRP injections do you suggest? So I'm a big fan of PRP. I do a lot of PRP in my office. The PRP that we do basically, you come in and we take your blood and we draw it out and centrifuge it and inject it into the scalp. A lot of doctors do PRP differently. I usually use 60 to 80 ml of blood draw. A lot of doctors only do 4 ml or 5 ml of blood draw. So I'm doing 10 to like 20 times more. And we do what's called a double spin PRP as opposed to a single spin PRP. So definitely talk to your doctor about PRP and how they do it. And if you're around, definitely come see me. I'm right in LA. Are you a fan of PRP? I've been doing it for a year, one treatment every 3 months. Yeah, so I'm a big fan. I don't do it that frequently in my office. Reason being is because again, a lot of doctors only use 4 or 5 ml, where I'm doing like 60 to 80 ml. So I typically do two PRPs initially, and then another one like every 6 to 9 months. So, but yes, I think it could work. It works about 70 to 75% of patients. Um, Somebody said I've been using it for 4 months, but I don't see the rest of the question. I found Nasal shampoo is better than 1% of the market. Yes, the 2% Nasal shampoo is better than 1% of the market. Do we have the shampoo on our website?
Just
Not
the regular shampoo and conditioner.
Yeah, we don't have the prescription natural shampoo. We only have the regular shampoo and conditioner. Um, what can I do to stop the hard and dryness? That's a good question. So you could actually buy like a scalp serum on Amazon. Like it's a topical scalp serum that you could apply on your scalp. Just Google scalp hair serum. You could also do a leave-in conditioner. We also have a product in our personal office called Gemma. It's like one of those. It's like a face moisturizer, like really thick collagen serum, and you could buy that on Amazon as well. I mean, it's a small bottle, but like it's a really hydrating scalp. It's a hydrating serum, and people use it for the scalp. So it's called Gemma serum on Amazon. But again, you could definitely do any hair serums basically as well. Um, I've been using the Happy Head since February. For some reason, I had to stop. I had to stop. I started again, and the hair is falling out too much. So again, remember, you could shed initially when you use the topical minoxidil, and that is normal. If you feel you're shedding again, and you can shed for about 2 to 3 months, and that's normal. My recommendation would be take photos at baseline and continue to take photos. Usually by 3 months, although you could be shedding, usually people have the same amount of hair as before, even more. So see how you do by the third month. If your shedding continues beyond the third month, then stop and just reach out. Please reach out to us. Do you have to see your pores in order for growth? Not balding, but the part is slightly wider. So you don't necessarily have to see your pores. I mean, I think when you say pores, you're referring to hair follicles. So if your if your part is wider, you still have hair there. So my recommendation is that topical could work for you. As long as you're not bald, you're a good candidate. I have androgenetic alopecia. Should I use a topical minoxidil solution, finasteride and the topical minoxidil solution and oral minoxidil? What is the ideal mix for me? So it really depends upon your hair loss, and when you apply some your basically to your doctors, our doctors will give you the recommendation. We know as a fact that if you use topical and oral at the same time, what's called sandwiching, you will see better results. Now, we're not saying start both simultaneously at the same time on day one, but you can certainly use like the topical for like 2 or 3, 4 weeks and then add the oral. And the reason why you want to do that is because you want to stagger. You want to make sure that you do topical, you don't have any side effects, and then you add the oral. So if you do the topical happy head and a month later you do the oral happy head, you will obviously going to see better results in 6 months for sure. And then there are some patients that also will alternate. That means one day do topical, next day do oral. We do have a bundles page or bundles formula, so you just have to reach out and they could basically set you up with the bundle. But yes, it is true that if you do both together, topical and oral, you will see better results as long as you're not having any side effects. All right, guys. Well, we have reached at the end of another AMA session. Thank you so much for joining us. Again, I'm Dr. Ben. I'm one of the founders of HappyEd. If there's any questions, please reach out to us at help@happyed.com. And let's see, please also leave us a feedback. I really appreciate it. We really try to get some feedback on a Trustpilot. We try to really have the best customer service, best product, really focus on hair growth. So if you could leave us a feedback on our Trustpilot page, I would really appreciate it. And also thanks so much to Francesca, Marie, and everyone else at Happy Head for making this possible. One last question: what do you think of using Jamaican black castor oil? So that's a good question. So there are some patients basically that say it helps them. I don't think it's going to hurt you. You know, I mean, really, it's really debatable how much it's going to help you, though. But it won't hurt you, though. You can use it in conjunction with the topical Happy Head. Thank you so much, guys. We're going to see you on the next AMA session in a few weeks. Just a reminder: we are getting off of the Crowdcast platform, and we're probably going to move on to a YouTube platform, but you should see that in the email with a direct link to our next AMA. Just FYI, we're probably not going to do a Crowdcast anymore. Thank you so much. Have a beautiful day, and goodbye.